Hi everyone, my name is Tilini Gunatillake and I am the Consumer and Community Liaison Officer here at Opus, and I'm here to talk to you about our consumer program. Now, before I begin, I would like to acknowledge the traditional custodians of the land on which I am joining you from, so the land of the Wurundjeri Woi-wurrung peoples of the Kulin Nation. I'd like to pay my respects to their elders, past, present and emerging, and I of course want to acknowledge and pay my respects to all Aboriginal and Torres Strait Islander people here with us today. Now, our research at Opus is focused around improving the patient journey. So it's really important that the beneficiaries of healthcare research, so the consumers and the community members, are also part of the research journey. This has led us to create a consumer and community involvement program, which I will be speaking about shortly. Now, before I get to that, I thought it would be great to touch on some definitions so that we are all on the same page. So we have adopted the definitions as outlined on the National Health and Medical Research website, so the NHMRC website, regarding consumer involvement. Now, consumers are typically patients, carers, family members, support people, and people who use the healthcare services. Community members are people who share a common interest but not necessarily live in the same area or access the same healthcare service. So different types of communities are likely to have different perspectives and approaches to their involvement in research. Now, the term engagement is also used interchangeably with other terms such as participation, partnership, involvement, but there are distinct differences in these terminologies. Now, participation is typically when patients and consumers are participants in a project, so data is actually being collected from them. Engagement usually involves sharing the findings of the project, so this is typically a one-way dialogue. And then you have involvement, and that's what I like to classify as a partnership. So they are part of your research team and they have put input into how the research should be carried out. So it can be useful to view consumer engagement as a continuum or a spectrum. So this is the model of consumer engagement that Cancer Australia have created, where there are different levels of engagement. So when you start with informing, it's really just to provide information to the consumer. When you move up a step, consulting, that's when researchers start to seek information and feedback via focus groups. Involving is when consumers are involved in the research process, and ideally when consumer involvement is built into all aspects of the organisation. Partnership is when consumers work together with health professionals and researchers. And then consumer-led is where consumers are able to set priorities and lead major initiatives. Now, these lower levels of involvement can risk tokenistic involvement, so it's not as genuine, and it's very much a one-way dialogue, and engagement is on a superficial level. So the further up you move, it can provide consumers with full decision-making authority and what I would say is meaningful involvement. The International Association for Public Participation also has a similar engagement spectrum. So again, the higher you go, the greater the impact the public can have on decisions. And this spectrum is actually used internationally and is found in a lot of the public participation plans around the world. So what is consumer and community involvement? So in 2002, the Consumers Health Forum of Australia, the CHF, and the National Health and Medical Research Council, NHMRC, worked in partnership with consumers and researchers to develop the first Australian statement on consumer and community participation in health and medical research. This was later updated in November 2016. We also share this vision, where consumers and research organisations work in partnership to improve the health and wellbeing of all Australians through health and medical research. So here at Opus, we like to view this as an active partnership. So there is this shared commitment and understanding and respect to that partnership. I first heard this saying, nothing about us without us, when describing how best to do Aboriginal health research. And I think that's highly relevant to how all research should be carried out, with and by consumers and community, rather than research being done to them or for them. So why should you do consumer involvement in your research? Well, there are multiple benefits. The number one, of course, is that it ensures that the research is relevant to the community needs, which is ultimately what we all strive for. Involving consumers in your research helps boost public confidence because there is greater awareness of the research and also the process behind it. So this increased transparency and accountability of the public money really helps boost that public confidence. Now, consumer involvement should also lead to a greater diversity in the research team, providing richer and more relevant research. Ensuring that the research purpose and outcomes are grounded in that real life experiences of consumers is highly valuable. So we want to really value that lived experience. And what I personally like is the increased confidence and empowerment consumers have upon stepping into a role in the research community. Now, of course, as with any program, there are a number of barriers to be considered, and I've just listed a few. So time, of course, is a big one. Researchers may lack the time to build the relationships or to manage consumers. There's time, of course, you need to account for when you undertake training and find consumers, establish meaningful relationships, which might be just too time intensive for researchers. Funding is, of course, forever an issue in the research world. Inadequate funding specific for consumer involvement activities, so you can support reimbursement and training, is a huge issue as well. And of course, from the literature I have read, organisation support is a big one. The lack of support from the exec can really dampen the success of the program. Tokenism, this also comes up very often in the literature, because a lot of people opt for those tick box approaches where engagement is very much on a superficial level, and that's why we really emphasize this idea of meaningful and active partnership. There are, of course, inherent power imbalances in consumer programs which need to be appropriately managed so both consumers and researchers are able to share power over decision-making activities. Unfortunately, the hierarchical, rigid models of scientific research is often favoured in comparison to models of research led by the public. This further perpetuates this imbalance. And I think this is where we need that, organisational support. So if the senior players support a cultural shift to prioritise community voices in the research, I think that's when we can really progress towards achieving balance. The lack of support for consumers is a very important consideration as well, because they can further isolate consumers and contribute to feeling lost in their role. So it's really important to have multiple communication touch points, which is where a consumer liaison officer comes into place, but also organisations outside of the research centre, or perhaps a consumer advocacy group or any other sort of organisation. But keeping all these barriers in mind, our research centre has established our own consumer and community involvement program. And to go with that, a framework to involve consumers and community in our research practices. So what does this look like? Well, our consumer involvement program, which I will call CCIP going forward, uses a 4-tiered approach to cater for the different consumer requirements. So these requirements, of course, dictated by the participants' time commitments and desired level of involvement. But ultimately, the outcome is to establish a meaningful researcher partnership, consumer researcher partnership. So just to take you briefly through our different tiers, tier 1 is where consumer subscriber. This is essentially a consumer subscribing to the information. Tier 2 is a document reviewer, where consumers will be involved in reviewing and providing feedback for documentation. Tier 3, a research buddy. This is where researchers and consumers will buddy up, and consumers will be involved right from the beginning through to dissemination. And lastly, as a consumer advocate in Tier 4, they take on the role of an advocate. So they will sit on committee meetings and advise on the consumer experience and point of view. To oversee the operations of the CCIP, we have established a Consumer and Community Advisory Group, which we call the CAG. They typically meet monthly to discuss the strategic direction of the program and resolve any issues or grievances, and can really provide that safe and impartial support for the consumers and researchers. So ideally, the CAG membership will consist predominantly of consumer advocates. So they will have a role as a chair and a co-chair, supported by, of course, the consumer and community liaison officer. We will also have a diverse range of perspectives, which will be, of course, the researcher, exec members, and students as part of this group. Now, consumers have ready access to the CAG, but they will also have other opportunities for training. So when they are recruited, they are invited to take part in an orientation workshop to really prepare them on their journey. This workshop has been co-designed and co-led by myself and our consumer advocate, Marion, who will be speaking later on in the panel. There's also opportunities to attend workshops and networking events to really facilitate their involvement within our program. And of course, the consumer and community liaison officer, having this type of personnel really provides that centralised point of contact for consumers and researchers, and most importantly, has a major role in building those long-lasting and meaningful relationships. Before I finish off, I just want to touch on remuneration, as it's extremely important that the time and expertise of consumer and community members are valued and appropriately remunerated. As you can see, it does follow a tiered approach, and we have created a policy document to make it really clear on the items that will be reimbursed and not. So it's really important that researchers and consumers have their expectations set right from the beginning. So our journey so far, we are piloting the program this year, and we have established a framework, but it will be a highly flexible and iterative program where we will seek regular feedback from our consumers to ensure that the program matches up to their expectations. We do have 12 amazing consumers involved in the program, but of course we're always looking to recruit more. So my shameless plug is that if you or anyone you know experience OA or have an interest in musculoskeletal health, please get in contact and come join our program. We're really excited for the road ahead. So we'd like if you can join us in taking this journey together. Thank you so much.